Hello, good morning. My name is Mariela Vidaurri, and I did my project on determining whether employers should require the coronavirus vaccine. I was interested in this topic because the vaccine is in its final stages. In other words, the vaccine itself is almost complete. We know that this virus spreads very easily. Nearly 14 million have contracted the virus, and unfortunately, over 270 people have lost their lives. This map demonstrates the amount of new cases from the past week. The darker red counties show a more concentrated areas of new cases, while the lighter counties have less concentration of new cases. All coronaviruses originate in bats. The transfer from a bat to a human is extremely rare, but the virus spreads from person to person much more easier. The first case of coronavirus dates back in late of 2019, and the World Health Organization announced the virus as a global disease on February 11th of 2020. At this moment, there are two possible solutions. Moderna has a vaccine that is said to be 94.5% effective, while Pfizer has a vaccine that is 95% effective. Distributing either of these presents a daunting challenge. For Pfizer's vaccine needs to be kept extremely cold, minus 70 degrees Celsius, while Moderna's vaccine needs to be frozen too, but only at minus 20 degrees Celsius. This brings me to my research question. Now, understanding how severe this pandemic is, should the vaccine approved by the FDA be enforced by employers? And would employees or students suffer consequences after refusing the vaccine? Vaccines have been required before, so the coronavirus vaccine wouldn't be the first. About 50 employees of Essentia Health, an upper Midwest hospital chain, were fired after refusing the influenza vaccine in late 2017. Students in public schools are required to receive vaccines before going to school, and the students from Laredo College are required to have the bacterial meningitis vaccination before stepping foot on campus. Again, this virus spreads very easily. It is estimated that an infected person can pass the virus along 2 to 3 other people, even in the early stages. We can expect to see this vaccine required by schools and medical care providers. And research for this topic will continue next semester. Information from my project came from EBSCOhost, which is a school-approved database, the Center for Disease Control, the World Health Organization, and New York Times. At this time, I would like to give a huge thank you to the Title III LEAP staff, especially Dr. Manuel Gonzalez and Javier Villagomez for helping me put my project together. Thank you for watching.